Hi, this is Dr. Jason Dulac coming to you from my office, Dulac Dental in Springfield in Springfield, Virginia. Today, I wanted to answer some common questions about dentures. What is a denture? Dentures can either be full dentures, so you're missing all the teeth, or a plate, some people call it. They can be individual dentures for individual teeth, which some people call a flipper or an interim partial denture, or they can be partial dentures. So you have some teeth, about half, say, and the other half are missing. Dentures are removable. They come in and out of the mouth. You can affix them into your mouth with implants. So a denture only has about 25% of the chewing function of the natural teeth. You're basically, instead of having tooth, which is the hardest structure in the body, going to bone, you're having plastic or acrylic go to your gum. So imagine, instead of hitting a nail with a hammer, hitting a nail with a hammer with a pillow between it. So you'll lose about 25% of your chewing function with dentures, which is why we want to save the teeth. But sometimes if they're beyond saving, there's advanced gum disease, there's rampant decay, you lost teeth early as a child, dentures are the best option. And now that we can affix them into the jaw with implants, it gives people a much stronger, much better fit, much better feel. They feel like natural teeth. They're not going to come out at you at dinner with your friends. So now that implants have come along, it gives us a lot of options for affixing dentures into the mouth. We have two options when we have implant-supported dentures. You can have like a little snap, almost like I do on this jacket. It snaps in and out of the implant. That's one option. The other option is to permanently affix it to the implant. I can take it out, but you won't be able to take it out. So you'll brush it and floss it like you would your regular teeth. If you do have a denture and it's removable, you do want to take it out at night, clean the remaining teeth if there are any, and the gums, clean the denture. And then I recommend sleeping without it at night, but you at least have to take it out to clean the tissue and the teeth before putting it back in and going to sleep. But it's best to keep them out at night. You kind of want to let the tissue breathe a little bit. Wearing a denture to bed is kind of like wearing a shoe to bed. You just want to kind of take that out, get that out of the mouth, give the mouth some time to rest. Also, a lot of people clench and grind their teeth at night. So if you have your dentures in and you're clenching and grinding your teeth, you're going to wear them down quicker. There are a couple different materials used to make dentures now. They used to be made out of porcelain. Now they're typically made out of acrylic. Recently, with their innovation in printed resin, we're getting printed resin dentures as well. Partial dentures have metal reinforcement. There's newer flexible plastics that can be used as well, like Valplast or Flexiplast, things like that. So there's a lot of different materials they can be made out of. I'll always give you all the options and give you my recommendation of what I think would be best for you. Just like anything else in life, there's advantages and disadvantages to any material that we use. So I'll always recommend what I think would be best. But there are a couple different options when you're looking at a denture or partial denture, and we'll always go over that with you in the office. To fabricate a denture, you don't need any numbing. The only reason the site would be painful is if you had recent surgery in the area. If it is, you'd want to let that heal a bit. But a denture involves either getting a scan of the teeth. We do have full mouth scanners in the office. Scanners are good enough now that you can even scan the gum for most people. So we're doing a lot of printed dentures or digital dentures that way. You can also do it the traditional way with molds, putty molds, and making it off of casts. So there's a couple different ways to fabricate it, but a denture is a pain-free process. It is a couple visits to verify the fit and aesthetics and phonetics and cosmetics of the appliance. We want to make sure it's exactly what you want before we process it. So it is a multi-visit procedure for most cases, but they're all pain-free. They don't involve any numbing or anything like that. Is it more difficult to speak with dentures? Properly designed dentures should mimic the phonetics. However, there is something now over the roof of your mouth. So it does take a couple weeks to adapt to the phonetics of it, usually 2 or 3 weeks. I recommend reading out loud to yourself at night before you go to bed for about 5 to 15 minutes. That helps you adapt more quickly. But there are some slight phonetic adaptations that need to take place. Typically, most patients within 2 to 3 weeks, they're fully adapted. They don't notice it anymore. How long do you let dentures last? I've had patients that have had dentures for a while. They do start to wear over time. If they're still comfortable to you and you're happy with them, stay with that. But most insurances will pay to replace the denture every 5 years. And that's because after about 5 years, there's usually enough breakdown of the acrylic or the teeth or wear that they would need to be repaired or rebased or remade in some way. You can repair dentures very easily, but a lot of times it's just better to start from scratch and get a new one. So, might be 5, 10, 15 years, but do need to be replaced periodically. If you're missing teeth and you have questions about dentures or implant-supported dentures or different options for replacing those different missing teeth, give us a call at the office. It's Dulac Dental of Springfield, 703-451-4500. Thanks so much.